So here we're going to continue with the digestive system, finish off with some general digestive diseases, and then talk about some that are specific to children and developmental problems in neonates especially. So one of your GI problems, I guess, it certainly doesn't fit anywhere else, that is facing many of us these days, especially those of us in the health industry who are dealing with the general trends in the population, is obesity. And this is, defined as the body mass index, which you probably, or you should remember from A&P, body fat index of greater than 30, or a percent body fat of greater than 30. Now, as it turns out, they're pushing that up a little bit, and it's not just to be nice and say, oh, you're not really obese. It's that they've found that someone who is otherwise healthy and active and has a body fat of 32, especially a female, is not necessarily any less healthy than somebody that has a body mass of 26 or 27. Now, 37, 38, 39, yes. If it gets serious enough, it's hard on the heart, it's hard on the blood vessels, it causes diabetes, it causes a number of joint problems and things that are very well documented. That either, right now the definition is greater than 30 of the BMI or percent body fat is considered to be obesity. Major cause of illness and death. Risk factor for many diseases, heart disease, cancer, some cancers anyway. And of course, that what has really caused it is we have very high nutrition foods. It doesn't mean they're nutritious in some senses, but a double stacker, Whopper, with 2 slices on it can be 1,500, 1,700 calories, something like that, which is a lot for that small amount of volume. It's a lot more calories that people are taking in than they used to, kilocalories. And we have less physical activity than we did. When I was growing up, people walked everywhere, they ran everywhere, kids played outside all the time, they didn't sit in front of PlayStations and computers and stuff. And so it's more difficult to balance the intakes with the caloric expenditures. Okay, whatever. Hormones that control appetite and weight are ghrelin and leptin. Ghrelin is the one that makes you hungry. If your stomach is empty enough, you will release ghrelin and you will suddenly have hunger pangs. If your stomach is growling, you're making ghrelin. That's the way I remember, that's the one that makes you hungry. Leptin is the other one. It's the satiety signal. When you are full enough, and that's why it's good to eat a little bit relatively slowly, because you have to give yourself time to respond to your stomach being full and send the signals that you don't want anymore. If you eat too fast, the signals aren't sent out until it's too late and you're so stuffed you can barely stand up. Prader-Willi Syndrome is a condition, well-recognized condition that you're born with. It's a genetic condition that makes you not respond to your hunger satiety signals. You can't tell that you're ever full. You feel like you're starving to death all the time. And so this is, it's not really their fault they eat so much. You have to spend a lot of, the family has to spend a lot of time actually preventing them from eating. Or they are so ravenous, it's like they feel like they haven't eaten in 24 hours. That's all the time, even if they just ate. This kid was born with Prader-Willi, and this is what he looked like a few years later. Just can't stop eating. On the other side of the coin are people that try to stay too light. Now remember, anorexia is just a term that means lack of appetite. So that's not really what we're talking about. These people, it's not like they don't have hunger pangs. It's just that they refuse to eat, refuse to respond to them. And so these are two conditions that are anorexia nervosa means the person simply refuses to eat, lose so much body weight that they look very skinny, very unhealthy, very fragile, and it causes your body to start eating your own proteins to keep you alive. And one thing it does is weaken your heart muscle to the point where heart failure is not uncommon. We've had a couple of fairly famous celebrities who died of heart failure because they were severely anorexic. Bulimia nervosa is when you eat and purge, binge and purge. You go ahead and eat all they can hold and then throw it up. Well, they get some nutrients that way. They're less likely to be quite as skinny, but it's very hard on the GI tract. It's hard on the esophagus. The acid eats away the teeth, and they do get skinny and they do get malnourished as well because they're not absorbing all the nutrients that they need. Now, unintentional starvation is widespread across the earth. In the United States, we have a lot more malnutrition than we have starvation. People don't eat enough of the right things. Even they can be obese, and they're not eating the right food, so they're malnourished. Some kids don't get enough to eat, but more often their problems are a lack of some nutrients than they are a total lack of calories. But around the world, they just simply don't have enough to eat, and they lack all manner of nutrients. And there are two primary syndromes that come from this. Marasmus is just, this is the concentration camp look. Don't get enough food, waste away, become skeletal and skinny from top to bottom. That's marasmus. Kwashiorkor is very common in places where maybe all they have to eat is some kind of rice or some kind of a root, and they don't get any protein. So they don't get enough food in general, but the real deficiency is protein. And the loss of protein damages the liver. It also results in a drop in your plasma proteins that provide some osmotic force to keep fluids inside the blood vessels. And the liver and other blood vessels elsewhere leak extra fluids out into the tissues and produce this is called ascites. Ascites is when your abdomen fills up with fluid. These kids aren't fat, they're full of water. So their muscles are wasting away and their stomachs are filling up with fluid. This can happen to people, to adults who have cirrhosis of the liver. They're not dying of starvation, their liver can't process anything, it starts leaking fluids out and they get ascites and they probably need a liver transplant. Cachexia is another starvation condition that happens to cancer patients. Liver disorders result in a variety of problems. The liver has so many things that it does. It produces your HDL and LDL and VLDL cholesterol, your lipoproteins. It filters your blood. It takes all of your nutrients from your stomach and kills the bacteria and then releases those nutrients into your bloodstream. It produces bile for the GI tract. It takes dead red blood cells out of commission and takes their contents that you don't want and puts it in the bile. The bilirubin, that is part of the coloration of a red blood cell, is supposed to be excreted in the bile. That's why your bile is a yellowish green color. If it backs up in your body, you turn yellow and you have jaundice. So a couple things that can happen that cause the liver to start failing to do its job: portal hypertension, high blood pressure in the portal venous system, and this is the blood flow coming from the GI tract to the liver to do its thing. Prehepatic problems means that there's vascular problems before it reaches the liver. Intrahepatic means it's somewhere inside the liver. And posthepatic means you've got a blockage on the bile duct on the outflow that doesn't let things continue to move. So, your blood vessels that are trying to bring the nutrients from the stomach and other tissues to the liver for its filtration can't empty into the liver. And so you get varicose veins, varices. They spread out. They could rupture. Herniations, bulges in the esophagus, the stomach, the rectum, the spleen, which delivers red blood cells to the liver for processing. And ascites. Failing livers produce fluids that fill up the abdomen. Here's ascites. Probably in someone in liver failure. Could be due to cirrhosis, could be due to liver cancer. Jaundice is, most people have heard of that, makes you turn yellow. And this is that buildup of bilirubin in your blood because the liver isn't taking it and putting it into the bile and getting rid of it in your feces. You're supposed to poop out all your bilirubin, not let it back up in your blood. If it builds up in the blood, you turn yellow. The skin is yellow. The whites of the eyes are particularly yellow. And so these are people who have liver problems generally. You can have obstructive jaundice where something in the liver isn't working. You can have hemolytic jaundice where there's a problem where you're destroying too many red blood cells for the liver to handle. So the liver may be working okay, except you're dumping too many red blood cells on it for it to get rid of all the bilirubin anyway. This can happen if you're absorbing a hematoma. If you had a big blood balloon somewhere and you're doing a good job of reabsorbing it, that's extra blood the liver may not handle temporarily, and you may become jaundiced for a while. Hepatic encephalopathy is where this buildup of toxins causes actually an inflammation of the brain, a damage to brain tissue, and cognitive disability. So here we have intrahepatic obstructive. There we have obstructive jaundice outside. So you've got a bile duct obstructed here, and here you're damaging the canaliculi inside the liver itself, so that you're not producing or transporting the bile properly. Here you're not able to conjugate it in the first place. Here you conjugate the bile salts and stuff, but you can't get rid of them because it's blocked somewhere else. Jaundice. Hematologic means you have too many red blood cells being broken down at the same time. So it's not that you're not processing them as well as you can, you just can't process all of them. And hepatitis means liver inflammation, but it's actually a liver infection, generally viral. There are bacterial and viral hepatitises, but the hepatitises that we're familiar with are the A, B, and C. And C actually has subcategories of D, E, and G viral hepatitises. A, infectious hepatitis from drinking polluted water. A lot of kids in third world countries wind up with hepatitis A. Hepatitis B is generally gotten through sharing of needles. Hepatitis C, also IV drug use, sharing of needles. And Hep C, these two are relatively treatable, and you take shots, you take vaccinations if you're going to work in the health industry that are quite effective. Hep C is harder to get rid of. They do have some new treatments that are working better now. But not only it's chronic, people have Hep C for years, but it is a very high promoter of liver cancer. And my best friend's wife's brother, who was an IV drug user for a little while, managed to get Hep C and ultimately died of liver cancer. Cirrhosis is inflammatory damage to the liver, and it is irreversible. You can stop it from getting worse if you stop whatever you were doing soon enough. Disrupts liver function, very common cause of jaundice. Alcohol abuse is the most common cause of cirrhosis of the liver. The liver can metabolize a certain amount of alcohol per day. It can't metabolize 2 bottles of wine a day. It just can't do that. It winds up, if you've ever seen a liver of an alcoholic, take a piece of liver and just drop it in some rubbing alcohol and let it sit. It looks like it was cooked. It turns gray like cooked liver. And it can be inflammatory problems, autoimmune, or from other sources that cause damage to the liver, which then spreads too. Not as common. Liver inflammation kills some of the liver. Scarring, which then causes portal hypertension. It causes an inability of fluids to flow through the liver. Ascites develops. I know someone right now who's in liver failure, and she is developing considerable ascites, edema, liver failure. And if you get to this level of cirrhosis, you either get a liver transplant or you die, pretty much. Remember, the gallbladder stores bile made by the liver and then dumps it into the intestine when you need to digest fats. It causes the emulsification of fats. And so the gallbladder, of course, has its own set of problems. People have their gallbladders out fairly frequently. You can live without your gallbladder just fine. You can even eat meals that have fat in them. You just don't eat a lot of fat at any one time. The gallbladder is called the colic cyst, the medical term for it. Colic means bile system, liver bile system, and a cyst is a fluid-filled bag. So this is the fluid-filled bag of the bile system, the bile bladder or gallbladder inflammation. So colic cystitis, cause of gallbladder problems, it just gets inflamed. Cholelithiasis, Litho means stone, like a monolith. And so there, a cholelithiasis is a condition of stones in the gallbladder, gallstone formation. They can be in the actual gall tubes of the bile ducts, or it can be in the gallbladder itself. Most gallstones are cholesterol-based. Either you're putting too much cholesterol in there, or you're concentrating it too much, because the gallbladder concentrates that bile. It stays in there too long and allows stuff to start to sediment out. And if it's kind of like a pearl in an oyster. Once you get a little one, it tends to attract more stuff stuck onto it, and the gallstones have a tendency to grow. You can also make some uric acid stones. We talked about uric acid in gout. Obesity, middle age, female are more likely than male. Native Americans are more likely to have gallstones. And any kind of disease that causes inflammation or causes the bile to stay in there too long. So, you make too much cholesterol, because these are cholesterol globs. Maybe you're not secreting enough bile that keeps the cholesterol, which is a lipid, emulsified so that it doesn't form into rocks. If you can't reabsorb the bile acids in the ileum, because when you use bile in your digestive system, you reabsorb it in the ileum and you reuse it. And so if the ileum has a problem, you can't reabsorb the bile, you don't have enough bile to keep the cholesterol emulsified so it forms stones. Kind of a roundabout procedure, but it would work that way. Gallbladder smooth muscle hypomotility. That means it doesn't squeeze and get rid of the stuff, so it stays in there too long. And genetics. If your family is genetically predisposed to gallstones, so are you. Look at those. Now that's some gallstones. To have in one gallbladder, no wonder they had that one out. Pancreatic problems start out with pancreatitis. You can have acute pancreatitis. It just, it gets bugged by something and gets inflamed temporarily and hurts a little while, and you don't digest your food as well for a little while. You have fatty stools and then it goes away. You can have chronic pancreatitis, which can become really serious, damage to the system. Alcoholism, again, is the main reason of chronic pancreatitis. And you do damage to the pancreatic ductal mechanisms, and the pancreatic juice can't come out fast enough. Some of the enzymes activate too early and start digesting your own pancreas. Epigastric pain. The pancreas is kind of under and behind the stomach, so it can hurt back here as well as here. Chronic pancreatitis related to alcohol abuse. Again, pancreatitis reduces your ability to digest fats. Steatorrhea or fatty stools. Malabsorption of fats and fat-soluble vitamins is common. And of course, pancreatic cancer. Pancreatic cancer, although they're getting better at treating it, is still one of the most lethal cancers that we have. So, cancer of the GI tract overall can happen anywhere: mouth, pharyngeal, throat, laryngeal, esophagus, stomach, colon, liver cancer, gallbladder cancer, pancreatic cancer. Some of them start there, others it metastasizes from somewhere else to there and starts growing there. Stomach cancer, most commonly found around the sphincters, actually in these same areas that are prone to ulcers. That's where it's prone to inflammation. Inflammation causes cancer. So up here and down here, inflammatory areas. Colon cancer, most of them are all the way down in the rectum. So colorectal cancer is a better term. Of course, if it's here or here, that's colon cancer. If it's here, it's rectal cancer. But colorectal cancer, since half of all of them happen right there, it's good to know. Colonoscopy usually goes back here. They may get all the way down here. And it is possible to go back up into the ileum and look around in there, especially if somebody has Crohn's or one of these other conditions that they need to look at. Here's a polyp. Remember, a diverticula goes the other way. It's an outpouching. A polyp sticks in on the side of the wall of the colon. Polyps start out benign. They gradually become more and more agitated and become more and more differentiated and become cancer cells and become cancerous over time. One of the best things about a colonoscopy is that you find these guys while they're still benign and you clip them off. They actually put a little wire around it and snip it right off and take them out during the colonoscopy. Okay, so GI problems in children. There are quite a few abnormalities that kids are born with. Kids will develop some of these other things. Very few kids develop colon cancer or pancreatic cancer. That's pretty uncommon. But they're likely to be born with a twisted colon or an esophagus that doesn't make it all the way to the stomach. Starting at the mouth, one of the first abnormalities that's not that uncommon in kids is this cleft lip and cleft palate. A cleft lip is the lip. The palate is the palatine bones in the top of the mouth don't close. And when the kid tries to eat or drink, it all goes up and comes out his nose. Risk factors: poor prenatal care, alcohol abuse, tobacco use, vitamin B deficiencies, other vitamin nutrient deficiencies, because they interfere with the particular cells that grow and close the GI tract, splits. The GI tract kind of is created like this, and it has to fuse together, especially up here. Various possibilities: a cleft lip that's only the lip, one that's got one side of the lip and the palate, one that's got both sides of the lip and both sides of the palate, and this one is just the cleft palate without a cleft lip. All possibilities. Pretty good at repairing those these days. Esophageal malformations, and atresia is an ending, a blind end to a tube that's supposed to keep going. That's what an atresia is. Here's the esophagus. It's supposed to go into the stomach, but it doesn't. It just stops. The stomach is down here somewhere, and the esophagus just stops. The baby eats a little bit and comes right back up. It can't swallow anything. Obviously, it needs to be repaired right away or the baby will starve to death very quickly. tracheoesophageal fistula. A fistula is an opening between two tubes that isn't supposed to be there. It's my cell phone going off. So in this case, a tracheoesophageal fistula is allowing the food to go into the lungs, and it's allowing the air to go down in the stomach, and it can be disastrous as well. I mean, the baby can get pneumonia, inability to pass the catheter into the stomach. You're trying to put the catheter in there and it won't go. Well, the hole isn't going all the way through. Pyloric stenosis is another condition where the baby can't move the food through. At least it makes it as far as the stomach. But the pyloric sphincter is so tight that it won't let the food leave the stomach. Again, projectile vomiting, failure to thrive, inability of the child to absorb any nutrients. They actually operate on this and remove part of the muscle so that it is loose enough to allow the food to go through. Projectile vomiting, hunger. You can actually feel the pyloric valve that's too big and powerful. When your intestine is developing, it starts out kind of in one small thing, but then it has to spread and rotate itself across so that you have the small intestine in the right position here, going to the ileocecal valve here, ascending transverse and descending colon in the right place. It is possible to have a malrotation where things are in the wrong place. It's not necessarily a big deal. It doesn't theoretically hurt to have this over somewhere else, except if everything is in the wrong place, you tend to form kinks and twists in the intestine. It's called a volvulus when you have a twisted intestine, and it forms a blockage right there where the food can't move through, and it also can block off blood flow to that part of the intestine and cause necrosis, cause part of the intestine to die, in which case it's lethal unless you do serious surgery and take out part of it. Laparoscopic surgery to reduce the volvulus, untwist the intestine. A meconium ileus can occur in a neonate. It actually occurs during fetalhood. And meconium is the intestinal contents of a fetus that isn't eating anything. I mean, fetuses don't eat. They get all of their nutrients through their umbilical cord, but they're still secreting stuff into the intestine, moving it through, digesting little bits of it and reabsorbing it, pulling the water out of it, and producing this kind of grayish, pasty stuff called meconium. And if it gets too hard and dry and blocks off part of the intestine, then you have an ileus of the intestine, and it can be lethal. It can be cut out, or if it's not too bad and they find it immediately, they can use enemas that are hyperosmotic that will draw extra water into the fluid and soften it up so that it can be moved on out. Lack of digestive enzymes. Maybe the fetus will develop those digestive enzymes but hasn't quickly enough Those cells haven't developed in time, and the stuff is getting in there and not being digested properly. Here's an obstruction. It's supposed to be something like that size. Here's the obstruction. Here's how big it is right before the obstruction, and here's how big it is afterward. So here it's backing up into the small intestine. This is supposed to be a small intestine. Looks pretty big, but here's the little tiny small intestine. It's just blocked here and not moving through. Ileal stenosis, jejunal stenosis, a jejunal ileus. I mean, it just means a blockage or a constriction that doesn't allow things to move through. An intussusception, we may have described this once before, is a telescoping of one part of the intestine into the other. It's like if you take a tube and push hard enough and part of it goes inside the other part of it. And it pushes way back in here. It can block off the ability of anything to move through because it squeezes too hard. It can pinch blood vessels and cause ischemia and cause necrosis, cause some death of some of the tissues. And actually, intussusceptions are the most common intestinal abnormalities in newborns. Mecodiverticulum or diverticulum. This is an abnormality of a developing intestine that has a lot of outpouchings. They're bigger, more dramatic than the outpouchings of a diverticulosis in an adult that you develop with age. Instead, you have these big outpouchings. Instead of having a smooth tube, it's going like this on the outside. Congenital malformation, in other words, actually genetically, a genetic abnormality causing this. And this aganglionic megacolon, also known as Hirschsprung disease, occurs when a growing fetus, remember the GI tract has a nerve plexus that goes the entire length and helps stimulate the peristaltic activities that move food through. If there's an interruption of that nerve plexus, the food will get this far and then it can't go any farther because, you know, it's like there's a blockage there. But all it is there aren't any nerves operating that part of the intestine to move the food from that point on. So it starts backing up here. This is in the colon. And the part behind it, of course, gets huge. And in a baby, you can have, you know, a colon that big and their stomach is sticking way out. So Hirschsprung disease, and it can be lethal. What they do usually is take out the piece of the colon that doesn't have the nerves in it and connect the two ends together. So here, the colon food is backing up in the colon, and here's the aganglionic portion that can't move it on out. Resection or removal of the non-functional part. Any of these things are fatal if they're not corrected. Kids are born with all kinds of things that didn't develop just right, just like the cleft lip, the cleft palate. Congenital anal stenosis. It's so tight that the baby can't defecate. Anal membrane atresia. There's a growth across the anus, and nothing can come out. It needs to be cut open. Anal agenesis. Didn't develop an anus at all. The rectum is up in there, but there's no anus at all. Rectal atresia. The rectum goes in, but it stops. Rectoperineal fistula. The hole comes out the wrong place. Here's where the anus is supposed to be, and there's where the hole is. Rectovaginal fistula means that the rectum and vagina join instead of the rectum coming out here where it's supposed to. They're all surgically correctable. We talked about cystic fibrosis when we talked about the respiratory system. Cystic fibrosis is a genetic abnormality that makes your chloride channels not function. And the chloride channels that are supposed to pump chloride into the airways, pull the sodium with them, pull water with them, keep the mucus soft so it moves out with the cilia like it's supposed to. But cystic fibrosis has the same effect in the GI tract, where you can't now pump chloride where you're supposed to. In the gallbladder, where you have to pump some chloride and run the ATP pumps and stuff to help osmotically concentrate the bile. In the liver, there are pancreatic insufficiency, gallbladder problems, digestive problems, overproduction of thick mucus in the respiratory tract. So it's, ion pumping insufficiencies throughout all of your systems. Abnormal concentration of bile in the gallbladder. This has gotten a lot of press in the last 10 years, and this is gluten sensitivity. Everybody wants to buy gluten-free this and gluten-free that now. And in fact, some people are sensitive to gluten. Most people are not. And there's actually no evidence that staying away from gluten, if you're not sensitive to gluten, is necessarily good for you. It's like, everybody should stop drinking milk because some people have lactose intolerance. It's very similar to that. Milk is one of the best things you can do for yourself. It's a really whole, wonderful food. Take this with a grain of salt, but most people, our civilizations lived on wheat and rye and barley and oats, and thrived for millennia that way. But those who are gluten sensitive are really at risk if they eat any of this stuff. It causes an inflammation of the lining of the intestine as bad as Crohn's disease. It can cause severe malnutrition, severe pain, dietary, genetic, immunologic factors is partly an immune attack that is attacking the substance that you're allergic to. Children who have it and are given cereals will fail to thrive because they can't absorb any food. Celiac disease is gluten sensitivity. Gluten sensitivity. Gluten intolerance is what I was going to say. Gluten intolerance. Celiac disease, this means the same thing. Antibodies, it's an allergic reaction of the lining of the intestine to gluten itself, and causes injury to the villus, swelling up and injury so that they can't absorb stuff, decreased hormonal production, decreased absorption of everything, carbohydrates, fats, and proteins. Both osmotic and secretory diarrhea, because you have inflammation that's causing secretion into the intestine. You aren't absorbing stuff, so you have too much stuff in there, and so more water comes in. So diarrhea, inflammation, pain, and malabsorption. We talked about kwashiorkor and marasmus, but we'll mention it because these are most common to kids. Kids who are malnourished develop the giant stomachs and look like they're, look like they're fat when they're not. Remember, kwashiorkor is the protein deficiency from kids who have such a limited diet that it doesn't contain any proteins. And marasmus is overall shrinking from lack of nutrition. And nutritional deficiencies will cause mental retardation, kids to stay small, 10-year-old kids that are 3 feet tall. Failure to thrive is the inability of a child for no obvious reasons to grow and meet guideline points. You should be this tall, you should weigh this much, you should be able to do this, you should be able to do that by 3 months, 6 months, 9 months, 12 months. Failure to thrive, they don't gain weight. Failure to thrive, it can be caused by an organic problem. They could have a blockage in the intestine. That would sure do it. They would have, if they have a gluten sensitivity and they're being given some kind of cereal, that would do it. Sometimes infants simply fail to thrive, though, and they can't find any real underlying reason. Or they can fail to thrive because of lack of nourishment. The kids that are starving to death or have kwashiorkor, they're not thriving either. So failure to thrive, it can be fatal. If something isn't done to improve it, the kid, instead of gradually going like this, usually won't stay like this forever. Eventually, they'll fade off. Gastrointestinal emergency in a newborn is if you have a damaged, twisted, ischemic area of the intestine that is dying, necrotizing. Enterocolitis, that means this is the small and large intestine dying, pieces of it dying. Ischemia, for some reason, leads to necrosis of the intestine. It can burst and cause sepsis, leading to full systemic infection. Immature immunity, the immune system doesn't handle the infections. Older parents, the older the parent, the more likely you are to have some of these difficulties. Here we have various pieces of dead intestine. I don't know if these all came from one kid who didn't make it or several different ones. I don't know. But these are necrotic, dead pieces of intestine. And diarrhea is not benign at all in a child. Babies can have diarrhea for a short time, but they don't have reserves. They don't have excess water that they can afford to get rid of. And diarrhea means that you're not absorbing nutrients, and it also means you're losing water. Children die of cholera very quickly. It's massive diarrhea, and they become so dehydrated and so hyponatremic. They lose so much sodium and chloride along with the diarrhea that they don't last long. Infectious diarrhea from E. coli and rotavirus and other types of infections. Rotavirus, 90% of serious diarrhea. When you get over it, yeah, this unfortunately it's a virus, but once you get over it, you're not immune to it. You could get it again right away. But there is a vaccine. Chronic diarrhea is any diarrhea lasting more than 3 weeks. And nonspecific usually means that they didn't get an infection by eating something bad. They have it, from Crohn's or from just a long-term improper diet, too much sugar. Don't give kids Coca-Cola in a baby bottle. There are better things than that. I'm even hearing too much apple juice these days. We always thought that was probably the best thing that you could have for the kid. No, not necessarily. Lactose intolerant or celiac disease will give diarrhea too. And we've talked about lactose intolerance. Not many babies are born with lactose intolerance because in the past they would have simply died. The only thing that they had to give them was milk. Now they can give them soy milk, they can give them lactose-free formula, they can do a variety of things. So their inability to make lactase in the first place means that they can't digest the milk sugars and they get massive diarrhea and gas and malabsorption. Osmotic diarrhea, a lot of extra gas. I've had students ask me, why do so many babies have jaundice? Neonates, when they're first born. Why do they have jaundice? Well, you could have a real serious problem, just like you have an atresia in the esophagus. You could have a bile duct atresia, and it won't let anything leave the liver, and therefore the liver can't clear any of the red blood cell, bilirubin out, and the baby turns yellow. That can happen. It's pretty uncommon. 80% die before 3 years if untreated, But most neonatal jaundice is just because there are a couple of things. First of all, their liver isn't functioning that great yet. They're not really good at filtering out the blood yet. It takes a few weeks before their liver gets, better. They also, in the process of childbirth, have a lot of extra hormones and things that the mother delivered to them. And so they're trying to process excess stuff for the first, week or two. And so it's not that uncommon for it to overwhelm the liver's ability to perfectly handle it right away. And so in almost all cases, there's no reason for alarm. It'll go away pretty soon. Babies can be born with hepatitis, almost always because the mom had it. If the mom had it, the babies get it. Now, infants can get it by unsanitary conditions, polluted water with animal feces in it, unsanitary living conditions, putting their hands on stuff, putting them in their mouth. So hepatitis A, which is the kind of orally ingested thing, is fairly common around the world. But hepatitis B and C pretty much come from either mom having it or having to get a blood transfusion with, some place that doesn't have real good screening of blood. GI pathology. That finishes that.